I'm Jessica. I'll be going over your surgery today. I'm the treatment coordinator here. I work with Dr. Stark, your dermatologist, who is actually the top dermatologist that we have here. So you're in really good hands. I just wanted to go over, what procedure we're going to be doing today. We're going to be doing the Mohs surgery, and it's due to your sun exposure as a child, which ended up causing your um, basal cell carcinoma cancer. So the first thing we're going to do is we're going to go in and we're going to use local anesthesia, which is, we actually use lidocaine that we'll be using just to inject the area. And then once the area is numb, we're going to go in there and we're going to remove the top layer of the tumor. Once that is done, we're going to send it off to our lab that we do have in our facility. At that time, we'll have our histotechnologists just go over everything. Usually what they do there, they'll go in and they'll cut the tissue down into thin layers, and then they'll add dye to it, or they're able to look under the microscope and determine if there's still tumor that needs to be removed. At that point, your surgeon, Dr. Stark, is going to look over it just to make sure there's not any leftover tumor. If there is, he'll go back in there, and whichever part of the tumor is what we'll be removing. So it won't be so much more that he'll be removing, just in the affected areas. We want to make sure we get all of the cancer out of there for you. The procedure can take anywhere from 1 to 2 hours. We do recommend that you eat before you come, or if you've already ate. With scarring, and there's not really that much risk of scarring. Of course, with any procedure that we're cutting into your skin, there could be scarring, just depending on how big the wound is, would determine if we would need to do any stitches. If the area does not need stitches, then it'll heal on its own. But if it does, we generally like our patients to come back within 5 to 10 days to get the stitches removed. And at that time, we can answer any questions or concerns, or if an infection arises, we can go ahead and address that there. As far as pain after the surgery, we just recommend Tylenol. It's not, an invasive surgery where you're going to be in a lot of pain. You might feel some discomfort, but not so much pain. So we can go ahead and get you started today. Just make sure, you are following everything that you need to be doing. And I'm going to go ahead, and I actually have a pamphlet that I'm going to give you that goes over everything you're needing, the type of medications we're going to be giving you today, any follow-up procedures, things to do, things not to do, just different things like that. And if you're feeling like you're still in pain or discomfort, you can always give us a call and just follow up with us, and we'll be able to get you in sooner. Thank you.